are almost here? Okay. I'm going to call this to order now that I hear the Senator is on his way, so we can start with my comments, and he will follow us. He and my colleague Rosa DeLaura are the authors of this bill. As part of the JEC's 2010 agenda, the committee has prioritized evaluating policies that will ensure that the jobs we create and preserve are quality jobs. The report evaluates the effects of expanding paid sick leave and estimates the number of additional workers who will not have to choose between a paycheck and their health. The report shows that the Healthy Families Act would boost job quality and economic security for workers and have the biggest impact on our most vulnerable low-wage workers. The report was requested last year by Senator Dodd, the chairman of the Senate Health Subcommittee on Children and Families. Paid sick leave is a critical piece of job security. Right now, 40% of employers in the private sector do not have it. And among workers in the bottom wage, 65% go without paid sick leave coverage. So 65% of the lowest wage workers do not have paid sick leave. In this time of great economic hardship and uncertainty, the absence of paid sick leave is one more challenge facing workers. Employers have been scaling back sick leave coverage in recent years. In New York City, paid sick leave coverage for near-poor workers declined from 56% in 2007 to 23% in 2009. We absolutely need to reverse that trend. The JEC estimates that 30.3 million additional workers, an increase of 56%, would gain access to paid sick leave as a result of the Healthy Families Act. It would benefit workers hit hardest by the recession and expand access to paid sick leave for many Americans, and in particular low-wage workers, women, and minorities. Almost half of the workers who would benefit, 14.7 million additional workers, are in the bottom wage area. 13.3 million women would gain coverage. 5.6 million Latinos and 3.9 million African American workers would gain coverage. This legislation would ensure that paid sick leave coverage was available to over 90% of private sector employees. The report underscores the public health impact of the Healthy Families Act. If workers get sick and go to work, they are less productive and can spread contagious disease to their coworkers and customers. Many without paid sick leave are in the occupations where there is significant contact with other people, such as food services and child care. And I don't think any one of us want to be served food by a sick worker or have our child taken care of by a sick worker. Today, only 2.3 million food service workers have paid sick leave. HFA would expand that number by an additional 6 million food service workers, a total of 259% expansion. Also, just 1.3 million personal care workers, which include child care workers and home health care workers, currently have access to paid sick leave. Under this bill, that number would double to 2.6 million. More and more people are living paycheck to paycheck. The pressure to show up for the paycheck, even when you're sick, has never been greater. No worker should have to choose between a paycheck and her health. And if and when this legislation becomes law, 30 million more workers would be covered under this law. We can do something that is both good for the economy and good public policy. Thank you, and I call on the author of this important, not of the report, but of the bill on which this report was based, Rosa DeLaura.
Thank you very much, Carolyn, and we're very, very grateful to you with regard to the report from the Joint Economic Committee and for all of your good efforts on this issue. I want to also say a thank you to Congresswoman Gwen Moore, Congresswoman Lynn Woolsey for being here and for their active part in this event, and a thank you to our good friend, Senator Chris Dodd, for leading the fight for the Healthy Families Act in the Senate. You got the report that Congresswoman Maloney talked about. It yet illustrates again how the Healthy Families Act would give American workers the flexibility that they need to look after themselves and their families when they are sick. That's what this is all about. 57 million Americans right now, almost half of all private sector employees, 79% of low-income workers cannot take even a single paid day off. But according to the JEC's estimates, and you, Carolyn referred to them, 30.3 million additional workers would gain access to paid sick leave through this bill, 14.7 million low-wage workers, 13.3 million women, 5.6 million Latinos, and 3.9 million African Americans. In addition, the report found that the Act will expand access to paid sick leave for the people in professions with the critical health implications. The food service workers, 5.9 million of them, who are dealing in food preparation. Only 15% of workers in the food service industry have paid sick days. Think back to last year and the H1N1 crisis. You know, if you're looking at the food service industry, not an industry where we want employees showing up to work with a contagious infection. Even the serious threat of contagion notwithstanding, paid sick days just make a simple economic fact. If you take a look at what's called presentism, the practice of coming to work sick, this costs our national economy more than it would cost to provide paid sick days. We have one study that says $180 billion is lost annually. I believe that was done by Cornell University. That means right now employers pay an average of $225 per employee per year in lost productivity, more than the cost of absenteeism and medical and disability benefits. You know, we have 145 other nations, 19 of the top 20 most economically competitive countries in the world. That is to say everyone except us, everyone except the United States, already guarantees some form of paid sick days to their workers. So the argument that we cannot afford to institute paid sick days right now doesn't really hold water. In fact, the opposite is true. Passing paid sick days would boost productivity. 5 years ago, after Senator Kennedy and I first introduced the legislation, it was 5 years since then, we now have in the House 120 co-sponsors, 21 co-sponsors as I understand in the Senate, Senator. It is also supported by a broad coalition of over 130 state, national groups, including the National Partnership for Women and Families, the American Association of University Women, and the Business and Professional Women. I was delighted to see yesterday that the Connecticut General Assembly made my and Senator Dodd's home state the first state in the nation to pass paid sick day legislation out of one of its houses. So I see it as a trend, and I hope it will be replicated across the nation. Let me conclude with this. The report indicates that the Healthy Families Act will give millions of Americans the freedom and the flexibility to take care of their health and the health of their loved ones when that need arises. It will protect the public health by helping to stop the spread of dangerous viral infections like H1N1. It will save employers money. It encourages productivity. It helps to boost our economy. We all urge our colleagues to get aboard on this legislation, and we need now to act on behalf of American workers and their families who may need to take a day off if they are sick. It gives me great pleasure to introduce to you someone who I don't think anyone has a broader and stronger record on making sure that American families are protected in this nation. It's not a recent involvement of his in this issue. It goes back for his entire career in the House and in the Senate. My good and dear friend, Senator Dodd.
Thanks. But I apologize to my House colleagues. This is typically what they think of us anyway.
Well, we said that.
I'm watching the expressions back here. Let me know if there are any raised eyebrows here as they talk about
We're not denying.
But the reality is we're right in the middle of votes. So normally I would defer entirely, and Rose has said so much, and obviously Rose and I is close to being family without being blood relatives. So delighted to be standing with her anytime. Carolyn Maloney and I have worked on a lot of issues together. Credit cards are our last great effort together, so it's an indication we may have some good work. And Lynn Woolsey, I'm a great fan of and worked with her over the years, and Glenn Moore. So with some wonderful people here who care an awful lot about these issues, and Rose has done such a great job. How I miss Teddy Kennedy. I miss him every day, but I miss him moments like this because he was such a champion of this stuff, and I'm picking up an effort that he and Rose have worked on together. And Tom Harkin's a great supporter. We've got 21 co-sponsors in the Senate, and we don't have a firm date yet. We're trying to get one for a markup of the bill. We've had hearings on the subject matter. I was tempted, I don't bring many charts with me, but I wanted to, in this case, almost bring these charts. And I just say three things to you. You got some good ones over here, but the ones that I think you only need to say the following. And in terms of probably, think of all the things we could say, and we're obviously proud of our state in Connecticut being the first state, I believe the first state.
Yes, the first state.
Our committee acted to provide for paid sick leave, and as the author of the Family and Medical Leave, going back an awful long time ago with Kit Bond and Dan Coates of Indiana, bipartisan Republican Democratic efforts to get that bill through on paid sick leave. Just consider the following numbers, and then all we need to do is ask ourselves whether or not we want to persist in a policy that would not provide for paid sick leave. 73% of food service workers in the country do not have paid sick leave. 80,000 cafeteria workers in schools do not have paid sick leave. 72% of child care workers. I can tell you as a father of a 5-year-old and an 8-year-old, I live in a petri dish. I've had nothing but a perpetual cold for 5 years, and sneezing and hacking away, and still am at it. And anybody who has children or been around them knows in months, you're just going to have time when you need to step back. And obviously we don't need people showing up, preparing our food, watching out for our kids, or being involved in cafeteria workers, as I said earlier, or food service work, and be ill. How much more do you need to know? At a time when we're trying to reduce people's time away from work, everyone else gets affected by it. The most it costs for the highest wage income earners are 23 cents an hour. When you talk about lower wage workers, obviously the number's a lot less. So this is an issue whose time is long since come, and as Rosa pointed out, actually, Rosa, your numbers are better than mine. I thought it was 137 countries. You've got 145. And you probably got to go and find some remote 4th or 5th world countries that don't understand and respect the concept that it's in everyone's interest to see to it that people who are ill are not contaminating others, putting us all at risk. In order to take some time to do that, provide obviously the economic resources, because people obviously can't do it. Particularly if you're a low-wage worker, you need those resources to come in. So we're going to get this done. It's obviously been a tough Congress on many, many issues, but I happen to believe that this is one of these issues that we come out of our committee in the Senate and come up to the floor and bring it up. Again, I don't know how you can really argue against this. So we've got some wonderful, obviously, effort over here, and I'll just do my very best in these waning days around here to see if we can't get this up and get a debate and pass this and join with our House members in really doing something significant. Those three numbers, just that 73%, 80,000 number, as well as these 72% of child care workers. Those three numbers say it all to me, and I congratulate my friends.
Thank you.
Thanks.
Thank you, Senator, for your decades of hard work on this issue and so many others, and thank you for being with us. Our next speaker is
Rosa will answer all my questions. Or Barney Frank will, if Barney's not around.
Outstanding leader on women's issues. Lynn Woolsey chairs the committee of jurisdiction in which this bill resides, and she is the chair of the House Education and Labor Subcommittee on Workforce Protections, and thank you for your great leadership, Lynn.
Well, thank you, Congresswoman Maloney, for pulling this together today, and Rosa for just steadfast, making sure we don't forget how important this is. And Gwen Moore, thank you for joining us, because you know we need all the new energy we can get around this place, and you bring it 100%. So if a child is lucky enough to have two parents in this day and age, both of those parents are in the workforce, because today most people work outside of their home, which means that providing paid sick leave is more important than ever, because that will make the difference for them in balancing work and family. This is why I've included the provision, the Healthy Families Act, knowing how very important, and it is the perfect first step in my balancing act, which is a comprehensive bill to support working families, so that no worker is forced to choose between putting bread on the table food on the table for their children, or staying with that child, or that parent, or that spouse when their loved one is ill. And taking care of themselves is very important as well. I was a working mother with 4 children, and believe me, it was a struggle to meet their needs as well as the responsibilities of my job, and that was in the 20th century. Well, now we're in the 21st century, and the United States of America is still lagging for parents who need to balance how hard it is to earn a living, commute to and from work, and then when there's a need in their family, feel like they could lose their job or they would lose a paycheck in order to take care of that family member. So we don't want to make parents, we don't want to force them to make those choices. And as Rosa and the Senator said, the U.S. lags behind the rest of the world terribly. Shame on us. It's unacceptable that this country, which is the #1 economy in the world, can barely compete with developing nations when it comes to sick days. So the report on the Joint Economic Committee is important because it proves to us something we already knew, nobody's surprised, that providing paid sick days is critical for today's workers. And the Healthy Families Act will expand that access to over 30 million workers. And our job, because everybody in this economy that can is in the workforce, our job is to make it possible for them to be in the workforce and still take care of their families in all ways. Thank you very much.
It was my hope that this JEC report would help build the case for the importance of this bill and the need to pass it. But our next speaker, Gwen Moore, who is Vice Chair of the Women's Caucus, is very good at moving issues through Congress, highlighting them with other members and to the leadership. And I thank her for championing this issue along with many others.
Thank you, Representative Maloney, and it is such a privilege to be here with these very hard-working and prestigious members of Congress. I want to thank them for this report. I think it's ammunition that we need, and I want to thank them for the Healthy Families Act, which we will pass through both houses and have signed into law. I want to talk to you about a few P's and just keep it real simple here today. Because you've heard everything already. Most of the working class are poor people, and this is going to help the working poor. I represent a city of Milwaukee where 69% of the electorate voted for paid sick leave in 2008, and it was stopped by the business community and by court injunction because of the fear that paid sick leave would ruin our economy. So I am so appreciative of this report, which will help us persuade those who are the employers that there will be greater productivity among workers as a result of paid sick leave. Also, I think it's important to point out that many women will benefit, we heard it here earlier, from this, particularly because they have the primary parental responsibility for taking care of their children. I can remember working for the city of Milwaukee, and they allowed me sick time, but didn't allow me to take sick time for my children. And so once all my children had chicken pox and I took off work, and I was not prepared to lie, and my boss, I called in and said, I'm going to fight this. I'm going to tell the truth. My children are sick. And he said, boy, you sound sick, and hung up on me. And so I think that in order to meet our parental responsibilities, women need sick days for preventive care. There's no point in talking about reforming our healthcare system if we aren't going to allow days off for people to take advantage of another big P, preventive care. And you've heard my colleagues here talk about the public health risk. We're talking about pandemics. It's not a matter of if there's going to be a pandemic. It's just a matter of when there's going to be a pandemic. And when there's a pandemic, the last thing we want is people making economic decisions to come to work and to prepare our food right on the subways, right on the bus, send their children to school because they don't have babysitters, and to make economic decisions about a day's pay because they can't afford to lose a day's pay. This could become a public health crisis when there's a pandemic and we don't have paid sick days. So we need it for productivity at work. We need it for public health and to prevent pandemics. We need it for preventive care to lower our health costs. And we need it so that women, in particular, can meet their parental responsibilities. Thank you.
Thank you, and we'd be glad to take any questions. Any questions?
Well, I'll start off with give us a nose count, give us a prospect here on the House side. Chris said he's going to try and get a hearing. What are your prospects here?
We have. We've had hearings.
We've had hearings.
We've had a
And
hearing
then,
on
now
it.
what? I mean, it hasn't come out of the committee yet.
No, it needs to
Well,
be marked up.
It needs to get marked up. We're
Right.
moved to do that. We're trying to get the co-sponsors on the bill. We have 121, which is a good starting point in the House to move forward on. And it's not as if people haven't been busy around here lately, so that, you know, in fact, I'm very encouraged. Look, let me just say this one thing. You had last year every public health official, every educator, the President of the United States saying, you know, the prospect of the H1N1 crisis, everybody was admonishing everyone, stay home, do not go to work, be there. You had to be home for a week. They told you that in order to ensure that you wouldn't be passing this on. Yeah, well, that was good for some of those folks to talk about. But you talk about the workers that Carolyn and Gwen and Lynn are talking about, people who are told that they can't take a day off and get paid for it. So they go to work because they have to go to work to take care of their families. Those of us who have health care and those of us who admonish others on this issue should take a beat and say, let's provide them with the opportunity for a limited amount of sick days, 7. That's all we're asking for, and they earn those 7.
And this is for businesses, businesses with less than 15 employees would
Exactly.
not be covered. I would like to respond to the gentleman's question. Earlier this year, this Congress passed paid sick leave for federal employees. That has passed the House of Representatives for 2 years in a row. That came out of the Government Reform Committee on which I serve, and it had strong support on both sides of the aisle. It is now in the Senate with Senator Webb, but oftentimes when we move forward with policies, the federal government does it first, or the military does it first, and then we go forward with the general public. But I think one argument is that 145 countries already provide paid leave. And I would say 145 countries are not wrong. The United States should move into the 21st century, realize that most men and women in families have to work. That is the norm. It is no longer the wife staying home to take care of the children. Economic necessity is that both partners have to work. And in our society now, in most families, both the wife and the husband both work.
There's just one thing I was going to add. I mean, this is one of the critical issues that face families today, because there is a difference in the family of yesteryear and the family today, as everyone has pointed out. You have men and women in the workplace. You have so many single-headed households today. And what is truly remarkable is how long it takes for our public policy to catch up with the dynamism of people's lives today and how that has moved forward. And we have policies that are static, that reflect another era. And then we're trying to play catch up. And we ought to be there on this issue. People don't decide to get sick. Their kids don't decide to get sick. It happens. Let's make public policy increase their opportunity for economic security.
I would add to it, go ahead, Lynn, go ahead.
Oh, I'm sorry. I was just going to say, I was a human resources professional for 20 years before I became a member of the House of Representatives. And I know every day that the workers that I was responsible for, who had paid sick leave back in the 70s and 80s, if they had to be at work when their brain was at home worrying about a child or a spouse or a parent, they were productive. And the other thing is, when an employer is loyal to their employee in their times of need, that employee usually comes back around and is helpful when there's a particular need for the employer. It works all the way around, and it works economically, and it works, takes the pressure off of working parents, and as it should.
If I could, everyone talks about family values. This is an opportunity to show that we truly value families, and we understand the challenges that they face. After my bill passed earlier this year, we went back and researched what had passed to help reflect the reality of so many women that single family had, or both men and women working, and nothing of significance had passed to help balance work and family since the Family and Medical Leave Act, and that passed in 1993. So this is an important bill to help families balance work and family, and to help families really adjust to the 21st century. And it's a way that we can show in government that we truly do value families.
Thank you.
Any other
Thank you.
questions?
Thank you.
On to